my name is Jordan Giesiger. This is the video presentation for Assignment 4, Nursing 610, Athabasca University. Ovarian cancer, what can we do? It's that time of year for the annual physical, that one-size-fits-all screening intervention that makes certain of health. Many women use this checkup as reassurance that they are cancer-free. The mammogram detects breast cancer, the pap smears cervical cancer, and a pelvic exam will make sure your ovaries are good, right? Well, that's mostly right. The mammogram does pick up most forms of breast cancer, and the pap smear is specific for cervical cancer, but the pelvic exam does not usually pick up ovarian masses. Ovarian cancer screening is the focus of my research question. What screening methods for detecting ovarian cancer in healthy adult women provide early detection, low mortality, and are fiscally responsible? Ovarian cancer is deadly. It has the highest mortality of gynecologic cancers and is the 5th cause of death among women with cancer. If you have ovaries or know someone who does, stay tuned. Every woman with ovaries is at risk of developing this disease. It is predominantly found in postmenopausal women. The symptoms are vague and easily explained away. There is no reliable screening, and by the time ovarian cancer is discovered, it is often too late. Ovarian cancer has a high mortality and low incidence. This makes it difficult to research, challenging to detect, and routine screening is not recommended by any medical association in North America. What can be done about this? Well, there are blood tests, the CA-125, ultrasounds, and surgical procedures. But does everyone need to have all of these done all of the time? No. Population-based screening for ovarian cancer is expensive, invasive, causes a high amount of false positive results, and is not recommended. A recent randomized control study in the United Kingdom has demonstrated a decrease in mortality with routine screening through use of a multimodal technique. This technique includes CA-125, your blood test, a risk assessment tool, and ultrasound for those deemed at risk. They found that this technique was the most sensitive method of detecting ovarian cancer and showed measurable decreases in mortality. This finding is exciting as it is the only one to associate a decreased mortality in ovarian cancer diagnosis when compared to other contemporary randomized controlled trials. I propose a targeted screening approach. This approach would ensure women with vague symptoms are thoroughly investigated, ideally detecting ovarian cancer early enough to decrease mortality. Through use of a symptom inventory tool, each woman will assess her own symptoms and identify their frequency. This tool is then scored by the clinician and the results are discussed with the patient. Based on the discussion, the numerical score, and risk factors, next steps are determined. Using a symptom inventory tool has the potential to impact women's health and detect ovarian cancer earlier. It has been validated for use in primary care and is an excellent addition to women's health. Use of the tool will educate, screen, potentially decrease the mortality associated with ovarian cancer. Why wait for late symptoms? Ask for the symptom inventory tool now.